maintaining good health with relying on the foods that are given from a vending machine or a cafeteria or donuts hanging around your office or desk, it's just naturally going to lead to the environment leading to bad habits, right? All right, let's rock and roll. What's up, everybody? Episode 52 of Pursuit of Balance. We're going to talk about sick care, not health care. We're going to talk about, I don't know, I guess a kind of a handful of things, but hospitals, doctors, nurses. I have a lot of members that work in the hospitals close to us, both in Mountain View and obviously Palo Alto. And a question that got brought up from one of my clients in noon class was like, hey, I got an episode idea for you. And I was like, okay. And she was like, I would like to talk about it was like a mixture of like burnout in healthcare, working in healthcare, and then, but more importantly, like trying to maintain optimal health. And I'm not joking. I would say probably 1 out of 8 people that come through our door. Like we have a lot of people that just work inside of the hospital system. And it's always something that I say that I'm very transparent about, that I'm like, it is one of the hardest industries to be able to maintain good health. And that's just because, there's a handful of reasons that we'll talk about today. But I also kind of wanted to mix, because I've had this written down for a while too, that I kind of wanted to mix in like another subject that I've always been relatively passionate about. And that's just kind of like where the healthcare system is in America. In my kind of opinion on where we are as a country is, I think it's very symptomatically focused. It's not focusing on root cause and solving the problem. And there's a handful of reasons why. And, to be very clear, like, I never want the message to come across that it's anything against doctors or nurses or anybody who works inside of the system. I think it's more of a systemic problem on kind of how things are set up. But then also, I really want to just tie everything into, for us as listeners, maybe for those that are working inside of the hospital or in the system, or those that are not, like, how can we still balance both sides of this, right? Because one of the things that I've always kind of preached to my team is, I'm like, we work in healthcare, right? We work on the preventative side of things. And when you think about health, there's a lot of things that go into it. It's not, just taking medicine every time we get sick. Like for me, it's like my philosophy is like, hey, a doctor is always going to be a need in life, but generally our goal is to not rely on this person and not, hopefully, never need to really use them unless something serious happens. If I need a surgery, if I break a bone, if I'm older in life and things need to, require hospitalization, then yeah, you use them. But I kind of honestly put it in the same bucket for me as using a lawyer, right? Like having a good lawyer is a great thing to have in business, but in life, but it's also something that hopefully most people never have to use, right? So there's a lot of things on the preventative side, obviously, that we'll touch on today too. But I kind of started just jotting down some facts of like things that I was like, okay, let's just look up, healthcare, because we all know that we've kind of seen the rise in obesity, the rise in diabetes, the rise in just basically all sickness and diseases, right? And we also have seen a huge uptake in spending on medical, right? It's like the first one I wrote down, for example, was like in 2025, United States spent $5.7 trillion, which was up 7.3%. And the US spends twice as much as other wealthy countries, but ranks last, right? Or towards the bottom compared to those other wealthy countries in life expectancy, preventable deaths, maternal mortality. Like, so there's like a handful of things that we can look at. Like, obviously the spending and the uptake in spending is definitely not solving our problem. And the case is like, why, right? Like, why are we not seeing, this graph start to go down? The interesting thing about the obesity side of things is, when I was looking up all these graphs and looking up all this data last night, this morning, is actually interesting. Since 2020, we've actually now seen the first time, I think ever, that obesity has actually gone down, right? So from whatever it was in the 40 something percent, and it dropped down to like low 40s or 40 on the dot. And I was kind of looking at that. I was like, oh, that's interesting. Like, I don't think I've actually seen that before. And I was like wondering, I'm like, how much of this is in relationship to, the wave of GLPs that have kind of been more mainstream over the last, 3-4 years. But no matter what, with medicine or without medicine, that's a great thing, right? I mean, obviously this is a number that we want to be able to get down. And I look at all these things. I mean, one of the things that's been very passionate for me is just like as a just a life principle is, when I lost my uncle, I was just out of high school. It was kind of like I remember like the reflective moment in life of like, wow, like, genetically on my side, both my grandpa, so my dad's mom, and then my mom's brother, passed pretty early. Like they were in their 50s. And it was just like kind of one of those moments of like, oh shit, like, life could be a lot shorter than we think sometimes. And a lot of us when we're kids, we think like 100 is the mark. So we feel like 50 is halfway there, right? But then you look at life expectancy and it's more like in the 70s or like, certain countries, maybe even creeping in like the low 80s. But like you think about that, it's like, wow, what if it is 50? That's like cutting it by 33% of like what a normal life expectancy is. And is that something that's genetically a part of my life because it's in my tree? So whatever, like long story short, like it's just kind of been something as far as me as like as a guiding principle with what I do as career and purpose of like, I don't want to be this person. I don't want to die at a young age. So like, what are the things that I can do to maximize both lifespan and health span, right? And and we see this, the just the increase in depression and anxiety and obesity and diabetes and cardiovascular disease, respiratory disease, like everything's just kind of been trending up for decades now. And so it's always been like a big passionate thing for me there's been moments where I felt like I was kind of like anti-medicine or anti-medical system. Um, but I'm not. I just think I'm more pro being proactive with the things that we can do to kind of address and fix these issues with not, like I said, needing to rely on some of these systems. Another thing that I wrote down a bunch of facts. I'm just going to jot them off as I kind of go down. Nearly 60% of American adults live with one chronic condition, and 40% of them live with multiple, right? And then even the kids, too. It's like the exact same thing. They were saying like over 60% of kids nowadays are living with one or multiple chronic conditions. And I remember these facts kind of with like the CDC during the pandemic and all these things, talking about all that. And then also another thing was like over 25% of Americans take 3 or more prescriptions, and then 17% take 5 or more. And then how the seniors actually, like obviously an older age, there's been like I think it was like an 18%. I didn't write that one down. I want to say it was like a 15 or 18% increase just in the last decade from the amount of medication that's being taken. And like I said, I think there is a time and a place for everything in life, and I think medication definitely has its purpose, and it serves a great demand for people that need it. But I look at it for most of us is like, are we relying on the medical system and med tech? Like, actually, we were in Healdsburg last weekend for the 4th, or when you're listening to this a week ago, whatever. And one of our good friends works in med tech, and I mean, this guy is literally building technology that's saving people's lives, right? And it's just like cool stuff that he talks about, and he's a genius. So he works a lot on like the cardiovascular side of things and heart, and right now he's pulling like blood clots out of veins, and it's crazy, but it's cool stuff. And so it's like there's plenty of stuff on the technology that is obviously serving a great purpose, but my kind of mission and kind of stance has always been, how do we prevent people from even getting there, right? Like, how do we prevent people from getting there? And I think the first thing is understand, like, the mindset and the lifestyle that you need to carry for the rest of your life is going to dictate how long you can go without needing to have it, right? Like, I don't want the kind of stance for most of us as humans to just be like, well, when shit hits the fan, I'll rely on medicine, right? Because, even like this has been a lot of conversation for me, I would say the last like year. But even I did an episode on this a few months ago about the GLPs, and like the interesting thing, like I have a client that's taking metformin, and he was like, "Oh, like I'm supposed to take it the rest of my life," and I'm like, "Oh, you're not like supposed to taper off?" He's like, "No, you're supposed to take it the rest of your life," and I was like, "GLPs the same way," and he goes, "Yeah," and I'm like, "That's interesting," like for me, like we all know some of the argument and people that have their disagreements with big pharma, and like you got to remember, big pharma is a for-profit company, and like their goal is to get people to use their things, and it doesn't matter if their stance is because we're trying to make people healthier, or if their stance is because we're trying to make money. It's always going to be a mix of both, depending on who you're talking to. But like I said, it's symptomatic. It's like, how do we avoid getting there in the first place, right? So here's like the next section I wrote down is like why doctors, I think, can't fix this, right? So when you look at nurses, doctors, people that work inside of the system, I think, has set up doctors and nurses and the entire education system for failure around this. Here's an interesting stat. U.S. medical schools average 20 hours of nutrition over 4 years, meaning that less than 1% of the lectures that they go to are about nutrition, right? And like, I don't know if anybody has ever heard this with the famous, who's the Stoic? Whatever. It's basically like, let food be thy medicine, kind of whatever the famous quote is. I forget who says it. But like one of the most powerful levers that we have when we think about optimizing longevity and optimizing health is nutrition, right? It's nutrition, it's exercise, it's time in nature, it's community, it's all these other things that I talk about so many times. And it's like, think about that. Like less than 1% of the education, and who knows? Like, I mean, I would love people to chime in for this, like, because I have a lot of clients that I'm sure are going to be listening to this that work inside the system. But like, if that is true, no wonder like we're not able to address things at a root cause because like we're taught a different way. We're taught that when this happens you give this prescription, right? And there's not a lot of things more on the holistic side or kind of what we would call like functional medicine doctors and things like that are kind of preached in your traditional medical system, right? And Western practice doesn't really address that, and this has always been my biggest kind of beef with Western practice for most things. Western chiropractic, Western medical system is just take this pill and that will solve your problem, right? But like the reality is like that pill will help solve maybe that symptom that you're dealing with, but that's not going to address maybe the root cause of why you're dealing with that. And then that thing leads to having side effects of this thing. It just like it compounds into this wrong direction for a lot of people when it comes to like optimizing health. So on the nutrition side, it's like, think about it. If you're a doctor that you're going to, you know, only has 1% of their time or education spent on nutrition, I don't expect them to be giving you much nutrition advice because they don't have much education in that. Now, that's not to say that your doctor or someone that you're going to is not doing any of their additional layer of self-education and nutrition, because ideally most of these people that practice it and are very passionate about their jobs would still be educating themselves outside of just the traditional formal, education that they have to do to become a nurse or become a doctor. And then even exercise too. Like I couldn't really find any hard data on the exercise, but it was just basically kept coming up that it's pretty neglected. It's not something that like is taught a lot on, some of the benefits outside of like, even in the nutrition side, it seemed like more of the education was on like biochemistry, right? It wasn't necessarily like on some of the more traditional stuff that we would talk about inside of the nutrition side. So I think like that right off the bat for me was just like, okay, like that gives you a little bit of clarity and like, I guess a degree of empathy to understand that like, why is this system not treating things at a root cause? And it's like, well, the system has taught us a certain way that is on the more symptomatic side of things, right? So it's like, well, that is treating sick care. It's not health care, like I said. Um, and then, so now to kind of transition to like a little bit of like the worker side of it too, because another interesting thing that I found, and a couple different sources on this one, but like one was like the number one unhealthiest job as far as the people that work inside of it was hospital, right? And I was like, wow, that's crazy. Like the people that you're going to better your health, right, or solve a problem around health are also the people that struggle with it the most, right? A couple other sources were like top 3, but whatever. Like it is way up there when you think about industries that struggle with optimizing their own health. And it's like, why? And I'm like, okay, well, the first thing I can think about off the top of my head is like swing shifts, right? Or 12-hour shifts or day shifts or night shifts or a revolving schedule. I know so many people, clients of ours that are like, oh, I just worked 3 nights. I worked at 7 p.m. to 7 a.m., right? I'm always like, I'm on the side of like, do you get to have the opportunity to go to days? Like where you can do like a 7 a.m. to 7 p.m.? Like, is that, I think from our circadian biology is going to be a big difference. Like just to talk on that, like think about that. Like our circadian rhythm is dictated by light, right? It's dictated by the sun. So if you're going and working inside of blue light, it's not that blue light is toxic, as blue light is basically telling the human body that it is daytime, right? When it's 2 a.m., right? Second thing was also the nutrition side. Think about the nutrition that most of these doctors and nurses are provided, right? In cafeterias, it's the same crap that we're serving in schools, the same crap we're serving in prison. It's a bunch of processed stuff through vending machines or not high quality foods. And I don't want to make any of these statements today blanket statements because I've never worked in a hospital and I don't spend a lot of time in a hospital. I have not been to a doctor in over a decade since I crashed my car. So actually longer than that, 15 years. So I think like, okay, why are these workers burning out? Why are these workers, like that question that got brought up to me by a client, like, why are you dealing with work burnout or why are you dealing with these health consequences? And I'm like, well, like, that kind of explains it, I think, just with the situation alone. Something that I found was like basically like 3 out of 4 nurses are emotionally exhausted every single week. Since 2022, 138,000 people have left the medical field as far as nurses, doctors, things like that. So think about it. Like I mentioned, it's like shift work, shitty cafeteria food, 12-hour shifts. Sometimes like I have a client and I would say a friend at this point, and she talks about like, hey, sometimes we're just very understaffed and like we don't get breaks, right? It's like we don't get like your typical, I guess if you were to think about this as code, illegal, but really from the reality of like having some balance in your lifestyle of like, can I bring my own food? Can I get time to actually go outside and walk? Can I get time to have a little bit of break if I need to rest? So think about working in a 6, an 8, a 10, a 12-hour shift and not having little to no breaks. I mean, that's obviously going to be something that will lead to burnout no matter what your job is or no matter how passionate you are about working inside of that. So for my clients, as far as like the message I try to preach for the people that are working inside the system is like, A, if you have the ability to do so, getting to day shifts is always the thing that I would recommend, right? Like it's just, I think it's from a circadian biology perspective, it's the best thing that we can do is just to get in alignment here, right? The second thing is you need to understand that your job does have different work hours than obviously the typical 9 to 5. So if you're working 3 12s or 4 10s or whatever your shift is going to be, like I said, consistency if possible is great, but then also remember that like there needs to be some prep on the nutrition side because maintaining good health with relying on the foods that are given from a vending machine or a cafeteria or donuts hanging around your office or desk, it's just naturally going to lead to the environment leading to bad habits, right? And to be clear, I don't think my message would change that different for most people working even quote unquote normal jobs, your 9 to 5s. There's some opportunities. Like I work with a lot of clients that work at Google or Meta or Amazon, and they have full-on cafeterias and full-on kitchens, and they have healthy choices to make. But there's also plenty of options to make the wrong decision, and that environment will dictate based off your level of mood. Am I just a little stressed out today? Am I tired today? Am I going to make the wrong decision today because of those factors? And obviously, like I said, that's where it kind of leads us down this path of health consequences, right? And then the big thing is remembering for those that like have 3 12s, right? Like I have a lot of clients that work like 3 days on and 4 days off. Like maximize your days off. Maybe you're not going to have the most energy to go do a hard workout on the days you work. That's fine. But maybe make that the day that you rest and recover a little bit. Maybe make that the day that you're hitting your 10,000 steps a day. Maybe make that the day that you do a little yoga or mobility or spend a lot more time in nature on your time off. Like, for me personally, I work out Monday through Thursday pretty religiously, and I try to squeeze 1 day or 2 days in on the Friday through Sunday shift. But, last weekend, I didn't do anything Friday through Sunday. I golfed one day, but like, that's a degree of movement, I guess, and it's a degree of being outside, but it's not like for me, I would like a little bit more. So for those 3 days you are working, like maybe maximize the nature time, maybe maximize recovering and relaxing, maybe maximize trying to get your sleep back together. But the more that you can be in these rhythms and trying to do your best to find them, the better off we're going to be from a health perspective. And this is no different for, the entrepreneur or, the executive or the person that has to travel for work all the time. Traveling for work and changing time zones is a very, very hard thing on the body for the exact same reasons. And this is where preparation will solve most of your issues and having some degree of structure. So when it comes to like my side of things of like what I would preach for most people, it's just remember that like exercise and nutrition is the medicine that the system is not prescribing, right? And it's like, is it because, I was trying to look because like there's part of me that I have a conspiracy brain that exists, like some of us do. And I was like, well, are doctors rewarded on prescribing? Are they financially incentivized to be able to give certain things on prescriptions? Because we see these things. I've watched movies before where it's like, the sales rep at Big Pharma trying to take the doctor out to a lunch or dinner to convince him to sell this product or medicine or whatever it might be. But I don't want to say anything that I don't have any facts on, so I'm not going to really go down that rabbit hole. But what I will say is like, the system is taught basically when there is an issue, for this issue, we prescribe X, Y, and Z. So as far as doing your job and following the job responsibilities and duties that you have, if I come to you and I say I have these really, really bad headaches, there is the holistic functional medicine approach of like, well, let's figure out why. Like, are you having headaches because you're malnourished? Are you having headaches because you are dehydrated? Like, are you having headaches because you're spending too much time on the screen? I don't know, right? Or I can give you this pill or this medicine that's going to get your headaches to go away, but it's not going to solve the root cause. And it's like, think about that. That solves a problem faster than most people. And here's the reality of the other side. As a client or a patient, most people that are in pain, aka those actually going to the hospital or a doctor for something, are at a point where they don't even necessarily want the holistic approach right now. They just want to get out of pain immediately. So I can also empathize with the other side to see that like those people that are even there are probably not even asking for the root cause fix. Maybe they're just like, just get me the fuck out of pain. Give me whatever you got because this hurts. So I do understand I kind of the dynamic that exists on both sides. But as far as long-term health for most of us, it's like, okay, what are the things that we need to do? Right. So like number one, like, exercise for me, it's like 150 minutes of moderate exercise lowers risk across all 19 chronic illnesses. And this is something that kind of popped up around cardiovascular disease, respiratory disease, diabetes, cancer, all these things, right? So if you think about 150 minutes, that's basically 2.5 hours a week of exercise. My prescription, 3 to 4 days, right? Meaning 3 to 4 hours. I would shoot that up, right? Because these are recommendations that I found. These are not recommendations that I would give. But still, a minimum effective dose. If you're getting into the gym for 2.5 hours a week, I'm doing a 45-minute session. I can do 45-minute sessions and do 3.5 workouts. That's great, right? 55% of the calories come from ultra processed foods. For kids, it's 62%. And that's like the current status right now, right? Meaning, like, if I were to look at this on a nutrition prescription, instead of prescribing you a GLP, like, as far as my goal on the proactive preventative side, is let's get us to come back to whole foods, right? Let's get us to come back to cooking our own meals. Let's get us not to rely on convenience and ordering food, Uber Eats, DoorDashes, restaurants, processed food, ultra processed food, refined foods. And it's not that these foods are inherently bad. These foods are just inherently going to be very calorically dense, and it's just going to make it much easier because there's no satiation or satiety around these foods to overeat. And it's like overeating is just a parallel with all cause mortality because as our weight goes up, as our diabetes goes up, blood sugar goes up, as our insulin resistance goes up, as our insulin sensitivity drop, all these factors, you got to imagine what it's going to do from a health perspective. And if you never change that, and you only rely on the medical system to do so, but not exercising, but not addressing the nutrition, what do you think is going to happen, right? Another one I wrote down is loneliness raises premature deaths by 26%, right? Being disconnected is more dangerous than being sedentary. And I talk about this a handful of times that, one of the number one predictors of longevity for people is the quality relationships, right? This is coming back to the community that you have, right? I put this as my fifth dimension, right? So it's at the core level of things that I talk about as far as how do we optimize health for people. And the core of that is the community and environment. What's the difference? Community is the people that you spend with, right? What is the quality of your relationship with yourself? What is the quality of relationship with your wife or husband or significant other, girlfriend, boyfriend, whatever, friends, your roommates, your family, sisters, brothers, parents, coworkers? The better the quality of all these relationships are, the better you can control these factors, the better the health outcomes are. The environment is where am I spending my time and how much time in nature am I getting? Am I spending time just walking from my car to my office and my car from my garage to my home? Or am I actually getting time to go outside and go play sports, go walk the dog, go golf, go hike, go swim, go surf, go snowboard, ski? Like, there's so many things that we can do that are not only enjoyable and active, but also get us outside, right? And that exposure to nature is an environmental change. So for me, it's like community and environment are obviously hand in hand, and that's why I put them in the same dimension. And the last one's obviously just the mindset, right? Like, there's a lot of people, and I noticed this during the pandemic, that just became like anti-medical or anti-medicine. And I will say there was a period of time where I kind of felt like that of like, why are we just like relying on this and trusting this all the time? And also like I've kind of come from this very primal point of view that like we didn't need to rely on this stuff as much as we did nowadays, right? And we're taking a pill because of a side effect of another pill that we're taking, right? And it's just like it seems like this downstream negative thing that's happening. And I would like my biggest goal in life is to be able to take people away from these things, right? And treating a medical system like a lawyer, that lawyers have their time and place, but like the goal is to hopefully never get into that place or that time of life. It happens. I get it. I'm going through something right now with some weird situation. And there's times that you're going to need to use it, but there's times and hopefully, or most of the time of our life, we'll hopefully never need to depend on it. So like the subject of this episode is sick care is our health care is what I would deem as sick care, right? Because it's treating symptoms, it's treating people with illness and disease. I think it has its time and a place, and there's so much advancements in medical tech and technology and medicine that I never want to say that you should never need to use these things, because there will be a time and place that we need to. And I think this is also the same thing that's going to get us the ability to be able to live longer, live into our 80s and 90s, 100s, 100 plus, right? You know, like we think this with the Dave Aspreys and the biohackers, you know, the Ben Greenfields, the Brian Johnsons and things like that. But the coming back to, how do I come back to what nature wanted us to have, right? And nature wanted us to move. Nature wanted us to be leaner and have muscle and be strong. Nature wanted us to walk, not necessarily doing high intensity Orange Theory Berry boot camp class all the time. Nature wanted us to have whole foods. It wanted things that a walk, flown, or swam before. It wanted things that are produce that needed sun and water to grow. You know, it wanted us to rest. It wanted us to have naps. It wanted us to sleep. It wanted us to be in alignment with the sun. You know, and like stress is something, when you're doing all those things, tends to be pretty low. I mean, for me personally, I can tell you right now, for a matter of fact, when I am spending more time outside, when I am spending more time with people I love, when I'm sleeping more, right? When I'm eating good foods, I'm exercising, I'm moving, I'm doing my mobility work, my stress is pretty fucking low. And when I'm not doing those things, my stress is high. And I'm like, think about that. What do you think stress is doing for all this? Right? We see this with a lot of times like that. And this is what scares me with some of the younger generation too, of not like younger generation coming up, but like what we did to kids, even my age, of prescribing medicine right away for, oh, this is ADHD. You got to take this for your focus. Right. And it's like, the reality of it is like, you know, my wife and I talk about this a lot with like screen time for kids in the future, of like, I'm like, I don't want our kids to be fucking like, I look at screens as just as the same addictive level of like sugar. You know, we feed kids a lot of cheap food because A, it's more affordable, totally understandable, but also it's easy, it's convenient, it's in a package. Just open it up, have something. Like, shut up, be quiet, stop crying. So like, I totally understand this pacifier effect that exists with food and technology, but it creates a lot of things mentally for kids that I think are just off the track of what nature intended, right? And it's like, go play, go be outside, go move, go be with your friends. Like, just don't be like this fucking robot that's stuck behind these things, right? You know, be healthy, have good food. And like that, I think stems from us as parents, making sure that we control those variables, or those variables in those environments. So, you know, as always, I think I probably rambled on in a couple directions. I didn't maybe talk as deep as I thought I could on like how I can help those that do work inside of the system, because that is obviously where this initial episode idea came from. But I hope that some of these points maybe kind of tie into some of the benefits and things that you can focus on to improve that. So as always, guys, I hope you enjoy that one. Share that with somebody that you think needs to hear it. And see y'all next one.